Hi, I'm Samantha, Doctor of Physical Therapy. Thank you for joining Health with Samantha DPT, and today I'll be talking about one of my favorite topics, the TMJ. So the TMJ is the temporomandibular joint, or this region right here, otherwise known as your jaw, and TMD stands for temporomandibular joint disorder or dysfunction. So anatomically, the TMJ region is your lower jaw or your mandible attaching to your skull or your temple. And this is the joint right here, okay? So in between the two bones sits a disc, and it's like the meniscus in your knees, a little fibrocartilaginous disc, and it protects the two bones and is involved in the mechanics of the joint. An important muscle I'm going to be talking about is the masseter, and it is this big one over here. That's your masseter, okay? It's involved with opening your mouth and chewing and tends to get really tight if there's dysfunction. So if you have a TMJ issue, some of the symptoms would be muscle fatigue and tension in this region. You have pain with opening, maybe some resting pain, clenching and grinding the teeth. Clicking and popping is a big one, and that has to do with that disc and the joint being out of place. So how does this happen? Well, there can be just a congenital issue, the anatomy you were born with for whatever reason. Things just aren't in alignment, or after orthodontic care, or even after procedure like getting your wisdom teeth taken out, the joint gets overstretched or it's unstable, whatever it may be, the bite is not correct after that, and now the joint is not functioning properly. There could be a traumatic event, say you fell off of something, hit your head or your jaw, had some blunt trauma, and that then influences the joint mechanics and causes dysfunction. One of the most common ones that I see is actually posture and stress related. So it has more to do with muscle tension in the upper quadrant, your shoulders, your neck, and your jaw. So a lot of that clenching causes tension in this area, elevating the shoulders, sitting at a computer all day, all of those postures definitely start to affect the joint over time, and then things become really tight and tender in this region. So what can you do to help? Well, usually with these patients, there's a group of clinicians that can be involved. Often the dentist, if your teeth are starting to get affected, you might need a splint. In the physical therapy world, we do a lot of hands-on therapy. So you may need an evaluation, but if some of these symptoms are connecting with you, I want to just show you a few things that you can do to help yourself. First and foremost, the resting position of the jaw, your teeth should not be touching, which actually might be surprising to you if you check in and you find that you're clenching your teeth. That might be something that you need to work on. So in the natural resting position of the jaw, the tongue sits behind the two front teeth on the roof of the mouth, back there, and then when my mouth is closed, my teeth actually are not touching. All right, so maybe check in occasionally throughout the day and see if you feel like you're clenching, and try your best to relax. And general relaxation, if you have a muscular origin of dysfunction, is something to always be working on. That can help. Secondly, to work on your end range of motion without overstressing the joint, because you may find that it's difficult to open your mouth all the way, is to do some tongue up opening. So you put that tongue behind your two front teeth on the roof of your mouth, and then you guide your lower jaw down with the tongue. Just like that. I would recommend maybe a set of about 20 a few times a day. You can do it in the car. And if you feel like your jaw is deviating to one side or another, that's actually pretty typical if you have a dysfunction, because one of those discs might be out of place. So that's something that your physical therapist would be working on with you. And finally, I would recommend just doing some self-massage of your own masseter, that muscle that I showed you. If it's really tense and pulling on your jaw in a certain way, you can just work on this muscle gently, sort of circular motion, a little bit of pressure to help get some relief in this region. Because a lot of the tightness here can actually start to lead to headaches and other things. So if you sort of just check in on your muscle tension and work on it yourself, you could find a lot of relief in this region. All right, I hope that helped educate you a little bit on this region. Comment if you have any other questions or like future videos on this topic, and subscribe for more videos on TMJ and other health related topics. Thank you for joining.